Hi, my name is William LaFleur, and my research question is, will assistive technology improve occupational performance in children with autism? One of the hallmark features of autism is impaired social interaction. Occupational therapists are uniquely qualified to assist these children in the development of social skills in order to increase participation in other occupational domains, including activities of daily living, education, and eventually work. Assistive technology devices such as computer programs and speech-generating devices are among the major intervention approaches used to remediate social impairment in autistic children and should be appropriately accessed by occupational therapists. The first study was a level 2 randomized controlled trial that included 61 participants with autism spectrum disorder between 5 to 6 years of age. The intervention investigated was the use of a speech-generating device in conjunction with early intervention tools that focused on communication, the Joint Attention Symbolic Play Engagement and Regulation, the JASP, and the Enhanced Milieu Teaching, the EMT. A speech clinician, special educator, or a child psychologist administered the intervention over 2 sessions. Each session consisted of 2 hour-long treatment sessions per week over a 12-week period. The comparison intervention took place under the same conditions but did not include the use of a speech-generating device. Only the JASP and EMT were utilized. This article showed statistically significant increases in total spontaneous communicative utterances. The limitations of this study were the inadequate sample size and the high dropout rate as the study continued. The second study was a level 2 randomized controlled trial that included 31 participants between 5 to 11 years of age diagnosed with autism. The intervention investigated was the use of the FaceSafe computer program. This program included 3 games which focused on attending to eye gaze and responding to joint attention, face recognition, and recognition of emotional expression. The interventions were administered for 25-minute sessions once a week for 10 weeks. The control group was administered a program called Success Maker, which focused on reading skills, exploration, open-ended instruction, and analytical skills. The results showed a significant difference in post-test affect recognition, post-test theory of mind score, and post-test SRS-2 score between experimental and control group. The limitations of this study was its inadequate sample size. The third study was a level 3 multiple baseline crossover design randomized controlled trial that included 6 participants ages 8 to 12 years diagnosed with autism. Each participant went through 4 phases of the study. The 4 phases were baseline 1, intervention, baseline 2, and follow-up. During baseline 1, the trainer practiced question asking with the child. The child was given 4 opportunities to respond with a question. In the intervention stage, each child had the opportunity to receive 2 interventions, one with a human and one with a robot. During both interventions, the child was told that they would be practicing question asking and was provided with 4 opportunities to do so. Group 1 conducted a robot trainer sequence. Baseline 1 phase took place over 3 to 5 individual 10-minute sessions. Intervention phase over a total of 8 10-minute sessions. Baseline 2 over 4 10-minute sessions, and follow-up over 3 to 5 10-minute sessions. The comparison intervention was exactly the same as Group 1's intervention, but reversed to have a trainer-robot sequence. Both experimental groups showed significant improvement in self-initiated questions between baseline 1 and intervention phase 2, and between baseline 1 and follow-up. The limitations of this study included inadequate sample size and a limited opportunity for variance data due to the amount of questions the children were allowed to answer. Study 4 is a level 4 non-experimental design study in which the authors recruited 22 participants between 14 to 18 years of age who were receiving special education because of a diagnosis of autism. The intervention involved training the participants how to use a personal digital assistant, or PDA, over the course of no less than 10 days and no more than 14 days. The training visits were performed by an occupational therapist in the participants' homes and included a 90-minute study enrollment home visit, a 90-minute initial training visit, and 3 60-minute follow-up training visits. The PDA was given to each participant for personal use over the course of 8 weeks. No control group was included in the study. Results showed a significant increase in performance and participant satisfaction based on scores on the Canadian Occupational Performance Measure. Limitations of this study included inadequate sample size and lack of experimental design. Thank you for listening.